Hi, my name is Rebecca, and I performed a neuromusculoskeletal and peripheral vascular assessment on a 22-year-old male. First thing I did was I assessed the neck. Range of motion was good. Then I checked cranial nerve number 11, which was called the spinal accessory. That was good. That was normal. The next thing I did was I checked range of motion on the shoulders, elbows, wrist, and fingers. All of the range of motion was normal. The next thing I checked was I looked at the skin. So there was hair even on both sides. Arms were symmetrical. Skin was dry and warm. Also checked for the capillary refill. It was less than 2. Also checked for skin turgor. That was normal, as well as there was pink nail beds. The next thing I did was I had the patient lay down and I checked the range of motion. I also checked the brachial and the radial pulses, and those were both present and normal on each side. The next thing I did was I laid the patient down. I checked for the femoral, the popliteal, the dorsalis posterior tibial, and the dorsalis pedis pulses on both sides. They were all there and they were normal. I could feel them. They had a good beat. The next thing I did was I checked the range of motion on the hips and the knees. We did exercises there. Also checked the range of motion on the ankles and the toes on both sides. Those were good. I also did the Babinski reflex. That was there. I did the patellar reflex. That was there as well. I also checked muscle resistance in the arms, that was all good. I also checked muscle resistance in the legs. That was normal as well. There was muscular resistance there. I did the patellar test. There was the patellar reflex was there. There was a negative Romberg's test. There was no swing. And then I also checked the heel to shin test, and that was negative as well. And then we did the spinal process. Spinal assessment. So I checked the alignment of the spine. I also checked the shoulders, the elbow gap, the scapula, the spinal iliac crest and the gluteal folds. Iliac crest and gluteal folds. And that was all normal as well. Also, there was on the legs, there was no edema. There was no varicose veins. The hair on each leg was evenly distributed. Legs were symmetrical. The skin was warm and dry. So, yeah, that was my assessment.